My name is Corey Cam, and I was in a group with Katie and Sydney, and our presentation is on psoriasis. So what is psoriasis? It is a skin disease that can cause red, itchy, scaly patches. It's super common and it is a chronic disease. Some of the causes of psoriasis is, well, they don't really know what the actual problem in the immune system is, but they do know that it is an immune system problem causing the skin to regenerate faster than normal rates. A lot of researchers say that genetic and environmental factors can play a role. It is a non-contagious disease, but a lot of people seem to think it is contagious, but it's not. And some of the risk factors for psoriasis include family history, smoking, and stress. There are some triggers for psoriasis if you are prone to it. There are different kinds of infections, weather, especially a cold or dry conditions, injury to the skin like a cut or a scrape, stress, smoking or exposure to secondhand smoke, heavy alcohol consumption, certain medications, and rapid withdrawal of corticosteroids. Some of the symptoms for psoriasis include red patches of skin covered with thick silvery scales, small scaling spots, commonly seen in children, dry, cracked skin that may bleed or itch, itching, burning, or soreness, thickened, pitted, or rigid nails, swollen and stiff joints, and there's also some different kinds of psoriasis talking towards the different locations, and so you can see the plaque psoriasis, the nail psoriasis, and all of the other different kinds of psoriasis, just referring to the different areas in which it's located. And for a diagnosis, your doctor is going to ask you questions about your health and do a physical examination. Your doctor also might take a small sample of your skin biopsy for examination under a microscope. That can help to determine the type of psoriasis and rule out other disorders that it could be. So for treatment, there's topical creams, phototherapy, prescription drugs, and there are also some non-traditional treatments that someone can try, including nutrition, physical therapy, and changing up their lifestyle and becoming more active. Psoriasis treatments aim to stop skin cells from growing so quickly and to remove the scales that may be on your skin. And so you can use the ointments, or there's also injected medication that go underneath the prescriptive medication. And it might take a while to figure out the best treatment for you. You might need to try different kinds of drugs or before you figure out the best approach. So for the prognosis, for most patients, psoriasis is a long-term condition, so it's a chronic illness. There's no cure, but there's a lot of effective treatments that you can try. Oftentimes, doctors may switch treatments every 12 to 24 months, and this prevents the treatments from losing their effectiveness and decreases the risk of side effects in treating psoriasis. And